It is being called a superflu, spreading across the U.S. and Europe. And in the U.S. right now, flu surges are said to be at their highest level in almost 10 years. But what exactly is meant by a superflu? Dr. Donald Vinh is an infectious disease specialist at the MUHC. Hi, Don.
Hi, Mitchum.
So, Don, is there really such a thing as a superflu? I mean, why is this term going around?
Yeah, so when we hear about this term superflu, this really refers to an unusually intense flu season with high impact, right? So it's been fast spread, lots of cases in a short time, a lot of people getting sick at once, rising hospitalizations. All of this leads to absenteeism from work and school, but also significant pressure on our healthcare network, and that's what's referred to as superflu, although there's nothing super about it.
So the spread of the flu has been bad so far this year, as you say, but is it the spread that is bad or the actual virus that is bad or both? I mean, what is behind it?
It's really both. But the spread is the bigger driver this year. So data from the Quebec Public Health Lab showed that early in the season, H1N1 flu was more prominent in Quebec. But then it was replaced by H3N2 flu, including this newer variant called subclade K, similar to what's been seen in Europe, UK, Japan, and the US. Subclade K picked up mutations that help it partially evade pre-existing immunity, allowing it to spread more efficiently. That said, although H3N2 tends to cause more severe disease than H1N1, there's no evidence that this subclade K has become more dangerous. What's really amplifying the impact is the environment for transmission. As we all know, a cold winter with more indoor gatherings, as well as low vaccination rates, this leaves more people susceptible. At the same time, this combination is what's driving the surge we're seeing.
So what's the status of the flu right now in Canada? Has it peaked yet, or can we expect it to get worse?
So based on Canadian surveillance data, we have not peaked yet. Influenza activity has been rising steadily across Canada since mid-November, with test positivity rates between 25 to 40%. So 25 to 40% of people tested are positive for flu. And of course, those cases have been drastically increasing throughout December. This tells us transmission is highly active in many regions. Now, the issue is when H3N2 predominates, as we're seeing now, we typically see higher hospitalization rates, not just in older adults, but also in children and other high-risk groups. Because hospitalizations usually lag infections by a few weeks, and we're just coming out of the holiday period, it's very possible we will see further increases in severe cases in early January. So Quebec may have hit its peak, but nationally, it's too early to say that the worst is behind us.
And we're being told, Don, that even though the vaccine isn't a good match with this year's flu, we're told to get it anyway as it'll lessen the intensity of the illness. Well, how does that work?
Yeah, so that advice is correct, but it often causes confusion, so let me clarify. Even when the flu vaccine isn't a perfect match, it can still significantly reduce how sick you get. The vaccine generates a broad immune response. Rather than just one strain-specific antibody, it generates an arsenal of antibodies. This means that even a drifted virus like this subclade K can still be partially recognized and neutralized, and that helps slow viral replication. Vaccination also strengthens cell-mediated immunity, which is less affected by mismatch and plays a major role in preventing severe disease and complications. So even in a year like now with a less than ideal match, the flu shot acts less like a shield that blocks every infection and more like a seatbelt, where it doesn't prevent the crash, but it can significantly reduce how severe the outcome is.
So there's a problem with the drop in vaccination rates. Meanwhile, the U.S. Department of Health this week, it's recommending fewer vaccines for most American children. So what does that mean for us here? Are we going to feel those effects as well?
Well, let's be very clear, right? Vaccination saves lives. That's true for the flu shot. But in Canada, only 30 to 40% of adults receive a flu shot annually. In younger adults, and in some regions, it's around 15 to 20%. Childhood flu vaccination rates are also around 30%. But this is well below the public health target of 80% for older adults and 60 to 70% for children, despite national recommendations that everyone 6 months of age or older should get a flu shot. So these low rates drive the intense flu seasons like the ones we're seeing. The news from the US, where flu and some other vaccines are no longer universally recommended for all children, raises big concerns because vaccine uptake could fall further there now and in the future. This doesn't change Canada's policy for now, but it can have spillover effects because Viruses cross borders, and so does anti-science, right? So these policy changes can cause more transmission in the US, which could affect timing and intensity of flu activity here, but also affect vaccine confidence in Canada, worsening the vaccination rates in the future. So clearly, we've collectively drifted astray, but it's really time to bring science back to the forefront.
Okay. Thank you very much for this, Don.
Thank you, Mitsumi.